Alzheimer's disease is a progressive neurological disorder that over time causes the brain to atrophy or to shrink. The brain proteins fail to function normally, and as the brain continues to shrink, the neurons don't fire properly, and so the brain cells begin to die. As the disease progresses, the patient's memory, behavioral, and social skills begin to decline, and this is caused by over a combination of genetic, lifestyle, and environmental combinations. People that are at risk are anybody as you get older. Most people over the age of 65 are at an increased risk for Alzheimer's. Women have also been shown to have an increased risk, but this is mainly because women tend to live longer than men do. Any kind of family history of Alzheimer's, if you have a first-degree relative, whether it's a parent or a sibling, you are at increased risk for developing Alzheimer's. Also, people who drink excessively, so an excessive amount of alcohol, does cause damage to the brain cells, which in turn can cause Alzheimer's. And then finally, lifestyle. So if people smoke, if they are obese, have lack of exercise, have hypertension, diabetes, or hyperlipidemia, they are all at risk for an increase in Alzheimer's. The symptom that most people will notice to begin with is memory loss. So you might notice that people have difficulty remembering recent occurring events or conversations. People may recognize the problem, but usually it is a family member or friend that will notice it to begin with. They may start to repeat statements or questions. They may forget appointments or events that are going to take place. They may misplace their keys or lose things on a regular basis. They may get lost when they're out walking or out driving. They will begin to forget names. Also, they will have problems just planning and parties or just planning dinner. They may forget that they have left something on the stove. They may also have change in personality. They may become aggressive, withdrawn, depressed, may not sleep as well anymore. So these are all symptoms. And, when it gets to a point, you need to see the physician, because then as a physician, we could start to do testing on the patient. So. First thing to realize is that there is no cure for Alzheimer's at this point. There are medications that we can use to help slow the progression of Alzheimer's and may bring back some of their mental capabilities to begin with, but over time, the disease will continue to progress. Other things that we need to make the lifestyle changes, keep their blood pressure under control, keep diabetes under control, have them eat a healthier diet, start exercising as long as they're physically capable of doing that. And then keeping patients engaged in family activities is also an important part of it. Going to church, social events, reading, doing puzzles, books, word search puzzles, board games, anything like that. If they play an instrument, just things that can keep their mind sharp as long as possible will all help in the treatment. Just want to mention that right now my mom is suffering from Alzheimer's. She was diagnosed about 3 years ago. She's 85 years old now. And so when I speak of what loved ones need to know, just know that I'm coming from this at a personal standpoint. So the most important thing is just to be patient with your family member, because it's going to get frustrating when they are continually asking the same questions or going over the same conversations that you've been through before. And as they get worse, taking care of them is going to get harder, because they're not going to be able to dress themselves. They're not going to be able to bathe themselves. So you're going to have to figure out how to do that for them or get help in doing it. Next, I think it's important for you to be able to ask for help, whether it's through a home health agency or getting the family physician to work with you to bring some aid into the home to help you. Don't be afraid to ask for that. If they're physically capable, I think it's important, again, for them to be able to go to church, them to go out to dinner, go to movies, go for Sunday afternoon drives, anything that will get them out of the house to get them, just get them doing something. Any kind of physical activity they can do. Playing an instrument, again, reading books, whatever it is that they're capable of doing, continue to do that. Just keep them engaged in routine activities. Keep them in a familiar surroundings, so don't move them from house to house. Keep them in one setting so that they get to know that setting. And if you have to send people in to take care of them, have everybody go to that house versus them leaving. And then also understanding the role reversal, that as a child, you are now going to become the caregiver. And there may be times when, you have to do things that they may not understand, or they may not like what you're doing, but it's important for you just to go ahead and do it if it's in their best interest. And know that if they get upset, that's going to go away and they'll forget anything that just happened that made them upset. So just know that as a caregiver, you have to do what's best for them and you have to pick your battles. So.